Hi, everyone. Welcome to Model 7. I believe you enjoyed the previous models. In this model, I'm going to walk you through how to create and develop your action plan to address female genital schistosomiasis issues. My name is Ruth Allotey. I'm a public health practitioner and a subject matter expert on female genital schistosomiasis from Ghana. I'm also an alumni of the Geneva Learning Foundation. In this model, we will be able to know all the necessary steps that we need to take in developing an action plan to address issues relating to female genital schistosomiasis. We will also explain how action plans can be developed from start to finish. And you will be able to do this with ease, as I'll walk you through an example from Ghana. Action plan development. I believe most of us might have probably heard of action plans or even applied it in our course of work. Sometimes, if you've not been able to be exposed to it or something, you might think it's a Herculean task. But by the time you finish with this model, I believe you can do your action plans with ease. It's important for us to divide ourselves into groups or teams within your sub-districts or regions. The second point is something that we always take for granted. I believe some of us will be saying, why do I need to write this on an exercise sheet? This is very, very important because whilst you put your points down on a piece of paper or on a sheet, you will be able to have it in mind. You will be able to look at the timelines as and when, and you finish your action plans within the time you have stipulated. It's important to assign a rapporteur or a scriber to write down your ideas and present it to the larger group. At this point, you have an hour to develop your action plan. How do we guide all of us to get to know how action plans are developed? And as I said earlier, the upcoming slides will show you a rubric or something like a guide that when you follow, it will walk you through step by step on what you need to do to develop your action plan. It's important for you to note that wherever you are in the healthcare arena, you can develop an action plan in relation to female genital schistosomiasis. It doesn't matter whether you work in a health center, in a hospital, a community, a school, or wherever you are within the geographical sphere within Ethiopia. You also have to note that because you are bringing out an action plan within your local settings, you don't need to incur any additional financial costs. You need to identify a challenge that is related to female genital schistosomiasis within the area where you work or wherever you practice. And whilst you identify your challenge, you need to set out your objectives. It's important to let us know your context where you work. Is it a tertiary level facility? Is it a community level facility? Where is it located? And what are the factors that make you think that the challenge that you have chosen, you can deal with it, it's feasible, and it's credible? So even though you are in Ethiopia and you write down your action plan and you bring in your context, even I sit in Ghana and chance upon it, I will be able to understand and see all the clarities that you put in there for me to have a picture of what pertains in Ethiopia. It's also important to have problem-solved real-world FGS challenges. It has to be real. Let us see what pertains in the area where you work. Why do you think that challenge that you have in mind needs to be tackled? And also think about the fact that when you're able to solve that challenge, what difference will it make in your area of work? So you can have a draft of the action plan, including who needs to be involved, who does which task at which point in time, and outline the steps in the process. Make your action plan time-bound. Make sure if you can complete a task in a week, in 3 days, or in a month, you write them down so that it will make it easier for you to complete your plan. A lot of people can start action plans, but they never finish because they don't make them time-bound. This is an important step you need to look at. Also, you have to let your goals be measurable. What is the goal that you are up to set? Can you measure it? If yes, then you are good to go. It's important to discuss your ideas with your peers. Do not underestimate anybody within your profession or where you practice. Everyone can contribute to help solve FGS challenges. Now, this is the rubric I was talking about. It's a guide for you to know what to do at every point in your action plan development. First, you need to describe a key challenge that is related to female genital schistosomiasis that you face and justify why this challenge is important in your sub-district. Why do you think you need to prioritize it? So initially, you can have more than 3, 4, you can number them. But when you look at all the challenges that you've numbered, which one is of highest priority to you? Why do you think you need to tackle that? And the challenges can be within the area of prevention, diagnosis, treatment, or referral, or even recording. For instance, in Ghana, we've been able to put FGS on our district health management information system, which is a major step that we've taken. I don't know about where you work and what you do, but wherever you find yourself within the healthcare profession, whichever team you work in, you will be able to find a challenge that is related to what you do. You also have to be specific in describing your challenge. Focus on what is specific about your situation and do not generalize. Why is this challenge important for you, especially where you work, for your patients, families, and relatives? Refer to direct observations. If you have data that can support your points, you can also add it to your action plan. Any evidence that you think is credible, you can add it, but you need to cite it so you don't find yourself being caught in plagiarism, as well as your own experiences. For this challenge, define the specific goal you aim to achieve with your action plan and justify why this goal is so important for you. Start small with your goal, be specific, and make sure it's something that you can do. Is it feasible? If it's not feasible, you need to look at it again so that you frame it within your own needs. Explain what will be different if you achieve your special challenge, the goals, and your action plan. When you finish, what is it going to bring to your health facility and your country at large? What are the benefits that people are likely to get? And is it a sustainable thing that you think, even if you are not there, people can continue to make sure that we end this menace on FGS? Think about this. As I said earlier, so this is a form, which is the rubric to guide you. And I think I've already walked through most of it. So when you start your action plan, you can look at it and go by it step by step. So in your action plan, you will be able to demonstrate to us what you think is a challenge. You have to think critically about the gaps that remains within your clinical setting and relate it to your challenge, whether it's a preventive challenge, a diagnosis challenge, treatment or referral, or even recording FGS challenge, you need to relate it and see which gaps are there that you need to fill. Also, you need to prioritize key challenges that you face, set a specific goal, and justify the focus. And then you identify concrete action steps that you need to address the challenge to achieve your goal. There are so many resources online that you can look up to. So we have the FGS Pocket Atlas. It's available online. You can also have the FGS Competency Framework. We also have a lot of WHO resources online that you can look at whilst you begin to write down your action plan. In the criteria of the rubric, there are categories that you need to look at. 3 criteria provide the structure for your action plan. And that's why I said you need to write them down, and that serves as a guide. So you can have this on the side, and then you continue your points on the sheet of paper. And by the time you're done, you see how easy your action plan has become. Your action plans need to be written within your context. Context means that, yes, you are in Ethiopia. Which level of work or the place you practice, what level does it fall? Is it a tertiary health institution? Is it a public institution or a private institution? What are the geographical features that make your place of work unique? So you have to explain anything that will make everyone, irrespective of whichever part of the world the person is, understand your situation so that you all be at the same page and enjoy your action plan whilst you find solution to it. Also, you need to introduce any other thing that you think can help us understand your context. Let us know whether your hospital, you perform pelvic examinations or not. You have resources to be able to do that. It doesn't matter if you work in a facility where you don't perform pelvic examinations, you don't do pap smears, you don't do colposcopy. You just let us know so that we can appreciate the place where you work. You also need to explain what others need to know in order for them to understand your context. Are there freshwater sources close to where you work? Are there schistosomiasis endemicity closer to where you work, or infrastructures that you think that because of that you need to work on the challenge so that a lot of people can be free from female genital schistosomiasis? This is a point we all have to note, that even though you may be working in an urban area and may not be close to a fresh water source, in this day and age, urbanization has made it that people who even grew up in places where there are freshwater sources and who might have had contact with fresh waters and might be suffering or may have complications may move to urban areas to work or to live and may be suffering with FGS. So don't underestimate the fact that you are not in an endemic zone or you don't have freshwater sources close to you. It's also important that you let us know the human resources of the place where you work or where you intend to have your action plan done and your project undertaken. What's the team size, structure, and composition of the facility where you work? Some of the complications that come to your facility, and you think these are complications that are related to female genital schistosomiasis, let us have a picture. If you have an annual resources, annual books, annual researches that have been done already within your facility that has data to support this claim, you can add it. FGS awareness, what you need to perceive at this level of awareness, what you need to do, you and your colleagues, the roles that you need to play, you have to put them down. By the time you finish, you have a beautiful action plan written out. You also have to let us know whether you know whether mass drug administration takes place within where you work. community campaigns on female genital schistosomiasis and any other thing that you think can substantiate your points are welcome within your action plan. The third main point to think about is your actions. And in this section, you should tell us actions that you have taken, what you intend to take, and what you propose to address the key challenges that you have identified so that you'll be able to achieve your goal. And in this section, you are required to describe existing action steps that you or your institution have already taken. Identify specific actions that you and your team members would want to take. Always have to remember to prioritize the list, be specific, link your points or actions to your goal. Make sure that you fit your actions to your context. Work with others. Teamwork will help you come out with a lot of fantastic ideas and will also help you to work faster, and you'll be able to make the change that you want to make. So teamwork is very critical. Identify resources that can help you achieve your goals. Also, in every project, there's one thing that you need to have. You should have a mitigation plan. So just in case the project doesn't go as you have thought of or as you have penned down, what next do you do? For instance, if someone is supposed to play a role and the person doesn't turn up, can someone else play the role of that person? You need to figure out any mitigation plans that can help you so that in case of any failure, you will still be able to achieve your goal. Now, the fourth point is for you to review your action plan to ensure it is both credible and feasible. Credibility talks about the clarity of your project. How feasible it is will let us know whether you really understood this model. Is this something you can do within your means? Is this something you can do within the resources that are available within your facility? These are things you need to consider. What are the human resource capacity of the team that you have? What are the special innovative ideas that people are bringing on board? These are the things you need to consider to make your work credible and feasible. Are there actions proposed by people that you think are convincing enough and can be done? That's what you need to consider. And you also have to be coherent enough and be concise in your action plans. And whilst I show you the example from Ghana, you will be able to appreciate that this is doable and you can do it with ease. At this point, you have an hour to present the action plan that you've done per your groups and also your group discussion. Are the action plan proposed credible enough? Will it be able to convince me sitting in Ghana to come and join your team to help fight FGS? All that you put down and your achievement will make the difference. You have to be coherent enough and be concise in your output. This is an action plan that was undertaken in Ghana. It was initiated by 40 to 50-year-old female, a nurse who is practicing in Ghana with qualifications in public health. The key themes of the local solution was to create awareness on female genital schistosomiasis and also encourage everyone who gets to know or see cases of female genital schistosomiasis where to refer them. Those were the themes that the writer focused on. The context of this action plan was in a tertiary referral hospital called Korle Bu Teaching Hospital. Korle Bu Teaching Hospital doesn't have freshwater source within its corners or walls. But as soon as you drive like 3 minutes away or 1.5 kilometers away from the hospital, there is a water source. It is also a tertiary referral hospital. That means that almost all the facilities within Ghana, as soon as they have issues that they cannot solve or handle, they refer to Korle Bu Teaching Hospital. And what makes Korle Bu a good place for us to undertake FGS awareness creation and case referral? It was so important because Korle Bu is a teaching hospital. It's also surrounded by the University of Ghana Medical School. It also has the nursing school, the School of Biomedical Science. A lot of health professionals are within Korle Bu Teaching Hospital. It is also resourced with a lot of equipment that we need to do colposcopy and the human resources that we need. We have lots of professors, doctors, nurses, all the specialties can be found in Korle Bu. As of the time that this action plan was being done, Korle Bu had about 21 departments with 5 centers of excellence. So this is the context within which this action plan was done. And the goal of this action plan was to improve on the level of FGS awareness to about 60% among healthcare professionals, patients, and patient relatives of Korle Bu Teaching Hospital by December 2021. So you can see from the goal that I just read, you can see its measurability, you can see the time bound, so it's going to be done by December 2021. And it's important that other things that we did for us to get to the end of this action plan was to do a quick questionnaire to know the level of knowledge that people have about FGS. And it was surprising. Most of the people that we engaged have not heard what FGS was about. So that led to us setting that goal to make sure that we make FGS awareness to about at least 60% of the people around this hospital. So the action plan was on awareness creation and was among healthcare workers, patients, and patient relatives who came to Korle Bu Teaching Hospital. As I said earlier, Korle Bu is a tertiary referral facility, and we achieved this through a quick questionnaire on female genital schistosomiasis. First, among the smaller team, health promotion team, where the writer leads, and also was able to expand this to the entire public health unit and then to the entire hospital. Social mobilization via Zoom, using WhatsApp links to WhatsApp platforms to share Zoom links was one of the ways that we were able to achieve this. And also, even though we always give health talks at the various outpatient departments, female genital schistosomiasis was not a topic that had been considered. So as part of the action plans, we added this to the topics for our daily outpatient education so that patients all over can know something about female genital schistosomiasis. And also we shared resource materials via hospital WhatsApp pages using the staff from the public relations team. And with this, we were able to achieve our action plan. We were amazed the number of people who were now able to talk about female genital schistosomiasis, to the extent that people who were not even within our hospital environs could find cases and refer to Korle Bu Teaching Hospital public health team, especially people who were involved in this awareness creation. The outcomes of this action plan was an improvement in the level of awareness and the cases that's now being referred to our facility. And all this happened because someone took the time, someone gave some commitment to be able to start an action plan and also to complete it. So I believe with this example from Ghana, you will be able to share with us your various action plans. And together we can help fight female genital schistosomiasis. Slides for this model were adapted from Bridges to Development training slides on female genital schistosomiasis. And we are grateful to all our sponsors and everyone who has supported us to make this possible. Thank you.